Namaste and welcome to CoViTalks, an initiative by Anamay Health Awareness. I am your host Aalekh Lahari. In the final episode of CoViTalks, we have with us world-renowned heart surgeon Padma Shri Dr. Ganesh K. Mani sir. Sir has done Namaskar sir. Sir has done over 20,000 cardiac surgeries of all types, and he is a pioneer in beating heart surgery and has a special interest in contemporary heart valves. Dr. Ganesh K. Mani sir, thank you so much for coming to COVID Talks and welcome.
Sure. Thank you.
Nowadays, sir, people have many myths about COVID. The question I would like to ask you is patients with comorbidities like diabetes, hypertension, and other heart diseases, if they are tested positive, can they be treated at home?
You see, you must all understand that COVID is just a normal flu. What happens is
Okay, sir.
it activates the body's defense systems, that is the immunological system, and the body tends to fight itself. This is what we should prevent. So it is in two portions. One is the infection, and the second one is the cytokine storm.
Okay.
Cytokine storm, when it happens, it cannot be treated at home. It has to be treated in hospital. But most mild to moderate infections can be treated very easily at home. First and foremost thing is not to panic at all.
Yes.
In the general population, there are people who are non-diabetic, who are lucky. There are people who are diabetic. This is part of the general population. And we know that even in the general population, just like they can get influenza, they can get cough and cold. Similarly, anybody with comorbidities, whatever they are, can also get COVID. It doesn't mean that if person has a COVID, he has to definitely get into a hospital. This is a myth. This used to be a common problem during the first phase of the COVID infection. And people used to rush to the hospital. And we had a lot of admissions. Some were justified, some were not justified. But what killed them is not the infection. What killed the people in the first wave was the cytokine storm. And we had not learned enough how to handle the cytokine storm. And that is why the diabetics, they fared badly. The patients with heart disease fared badly. Now we have more understanding on the subject. Unfortunately, the second COVID phase, the second exacerbation or the second innings, if you like,
Yes.
that has does not have the same symptoms and the same speed. This seems to be a kind of a fast forward infection. Fast forward in many ways. It is more infective, and people tend to go into the cytokine storm very quickly, and that is why we are more scared, or rather the correct word to use is we are terrorized by the second exacerbation.
Yes.
Nevertheless, I think you are from Bhopal, isn't it?
Yes. Yes, sir. Yes.
City of Bhopal.
Yes, sir.
So I feel that, in a place, it's a kind of a cosmopolitan place. Easily, small amount of home treatment can be done.
Right.
I do not know whether you people have oxygen deficiency like Delhi has, but I'll tell you how to go about it in a methodical fashion. See, there are two aspects of COVID. One
Yes.
is the pneumonia, and the second one is the thrombosis.
Okay.
Thrombosis because the activation of the platelets and other coagulation factors makes this a very thrombotic condition, prothrombotic condition. So what we need to do is to prevent the thrombosis. Infection is not a major problem. I'm telling you again and again, the infection is not an issue. It is the after effects of the infection, after effects of the thrombosis. This
Okay,
is
sir.
what we should get worried about. As far as infection is concerned, any kind of antiviral, they have been subscribed. I will just quote you what the All India Institute of Delhi has propagated.
Yes.
That is a small amount of ivermectin, colchicine, and inhalational steroids. This is all that is required for home care. Yes,
Okay.
we do need oxygen because oxygen monitoring has to be done. If the oxygen drops below 94, it is better to give them supplemental oxygen. This can be done in two ways. One is by oxygen cylinder, and the other one is by the oxygen concentrator.
Concentrator. Yes.
Yeah, both these are available in India and it can be
Yes.
very easily managed. Caution, number one, you should know how to connect an oxygenated oxygen cylinder
Cylinder. Yes.
because when you open the spanner,
Valve. Yeah.
oxygen comes out in a gush, and this can sometimes cause a major discomfort to the patient. So do not put the nasal prongs or the mask before you open the oxygen cylinder. There are two portions of the oxygen cylinder. Number one is this, which needs a spanner by which you let the pressure out of the cylinder. The second one is the oxygen flow meter. The flow meter, all you require in COVID is 2 to 3 liters of oxygen. You don't have to put 15 liters. You
Right.
put 2 to 3 liters. And after you find that the either the nasal prongs or the oxygen mask, there is oxygen coming, then only you attach to the patient.
Okay.
There are available methods of increasing the oxygenation. Normally, if you just give 2 to 3 liters of oxygen, if a patient is desaturated through 92, 93, he'll immediately come back to 97, 98, 99. But if a person is desaturating and continuing to desaturate despite your low flow oxygen, then we have to change the strategy. Instead of a loose mask and a loose nasal prong,
Loose. Yeah.
we might have to have a more fitting mask.
Right.
And then we may have to have a rebreathing circuit. Now, this all needs a doctor to be attended. Then only they can do rebreathing circuit by which you can increase the percentage of oxygen. But in home care, I'm advising people that if it drops to below 92, 93, even after 2 to 3 liters of oxygen, you need medical assistance. Call your family
Right.
doctor, and the family doctor will be able to adjust. Have a rebreathing bag if you have, and if you have a NIV mask, that will be helpful because then the leakages will be stopped and the concentration can be increased. All that you require to do in home is only oxygen. The other thing is antiviral drugs. Antiviral drugs that are known to improve the situation is ivermectin and then to a certain extent colchicine and favipiravir. Now, favipiravir is not easily available, so it is not required. It's an antiviral drug.
Right.
But ivermectin and colchicine are more easily available. They are very
Yes.
cheap
Yes.
and that can easily be given in a small dose. We have a protocol. I'll send you the protocol later,
Yes.
which
Yes, sir.
All India Institute has circulated, which we can use for ivermectin. Then there is a budesonide.
So nice. Yes, sir.
This is a spray, and this can be used as an inhalation. The advantage of these inhalation, that is a steroid. Normally, we don't have to give a steroid, but in the initial phases, inhalation steroid is good enough. If after all these things are dropping, of course, now this also needs continuous management of diabetes. Since you asked about comorbidities,
Yeah. Yes.
we should not neglect the diabetes. Diabetes has to be treated. If a person is on oral hypoglycemic agents, he should continue that. They should not stop it.
Right.
If he is on insulin, he should continue the insulin, the same dose. There is a word of caution. When you use inhalation steroid, there may be a slight elevation in the blood sugar, which can
Yes.
easily be managed by adjusting doses, nothing to be alarmed about.
Yes.
However, if you have to go to oral steroid, which is when the things get worse. When you're going from mild, you're going to moderate. In that case, we have to use the steroid. And when we use steroid, the diabetes will go helter-skelter. And
Yes, sir.
we have to be conscious about that. We shouldn't get alarmed. We should be aware that if diabetes sugar rises, then we may have to increase the insulin, or we may have to increase the oral
Oral
hypoglycemia.
dose.
These are all in the realm of family physician, and most of this can be done by the family physician. In addition to this, there is a tendency for patients who have got heart disease that they should not be able to be in a prothrombotic state, because slowly, without our realizing, and especially with this fast forward type of a variant, there will be a prothrombotic thing that will happen. If a person is taking aspirin or clopidogrel, he is a little bit protected. He should continue that. He should not stop aspirin. He should not stop clopidogrel. He should continue that. If he is not on aspirin and clopidogrel and he has got evidence of heart disease, then the doctor may prescribe something called low molecular weight heparin. Like,
Right.
for instance, there can be an injection which can be given twice a day. It is given subcutaneously. That is if you choose enoxaparin. But if you use fondaparin, which has got a 24-hour cycle, we can give it once a day.
Right.
These are all things to prevent. After infection, we have gone on to thrombosis.
Thrombosis, yes.
These are the two things that alter the progress. If you have adequately controlled the thrombosis, if you have adequately controlled the infection, and you have adequately controlled the hypoxia, you're cured. 98 to 99% of COVID can be treated like this. 1 to 2% will not listen to you. They will go in a fast forward. And then we have to realize when we have to shift the patient to the hospital.
Right.
When a person, despite your medical management, as I have told you, patient goes down, if the saturation goes down, then we have to alert the hospital, because, after all, everything cannot be done at home. There are certain limitations of doing things at home. You need intensive care. There is another thing in home care one can do, which is a very easy thing. That is prone ventilation. Like,
Right.
instead of the patient lying on his back, he lies on his tummy.
Stomach. Yes.
Stomach. That is, you put two pillows on the shoulder and two
Right.
pillows on the pelvis. So the abdomen should be free. If the abdomen is free, he can breathe easily. If the
Right.
pillows are on the abdomen, then he won't be able to breathe. He or she won't be able to breathe.
Yeah.
So prone ventilation also improves the oxygenation. So these are the things that one can do: prone ventilation, oxygen therapy, ivermectin, colchicine, budesonide. Beyond that, it is generally recommended that you should see a physician. Physician can treat you up to giving you subcutaneous heparin, and he can increase the oxygen supply
Oxygen supply.
by organizing a rebreathing circuit. If after this it doesn't improve, then one has to go to the hospital. In the hospital, of course, again, like I have told you, home protocol, there is a hospital protocol also. There is a hospital ward protocol, there is a ICU protocol.
Right.
I think because it's a general audience, I will not get into that, because basically I wanted to reassure you that 98% of COVID can be managed by you all at home. So there is no need to rush. Be confident. And of course, there is very important thing which alters immunology is the generation of endorphins. Endorphins are hormones that our body produces, and this comes out of lack of tension. You're easy. Like, for instance, if you are doing bhajans, you're singing songs, you are talking to each other in a friendly fashion, you're not fighting. All this increases your endorphins. Endorphins increases your immune response, and it will be able to contain the virus.
Right. Right.
What is cytokine storm? I'll just give you a brief thing, though this is not in the realm of your management at home.
Yes.
When there is cytokine storm, you have to take them to the hospital. What are the indications that there is cytokine storm? One is that if you do a blood test there may be markers which are called biomarkers, that is the IL-6, ferritin. These will
Right.
go up. If
Right.
these go up, that means you're beyond being treated at home. If they go up in a very exponential fashion, if it's a mild elevation, you can still treat at home with a family physician supervising. So these are the basic things I wanted to tell you. Diabetes or hypertension does not preclude you from any of these. The other thing is about heart patients who have got heart valves. They are on anticoagulation.
Yes.
Now, patients who are on anticoagulation, now they can, if they go for vaccination, they can have hematomas. So
Right.
if the INR is below 2, that is, you do the INR,
Yeah.
prothrombin time.
Yeah.
If the INR is below 2, you can safely go ahead and get a vaccination done. There will be no problem.
Right.
If your doctor has aggressively anticoagulated you and you are maintaining INR of 3, then you just drop the acetrom or warfarin tablet a little bit so that your INR comes around about 2, and then you can go and get vaccinated.
Right.
Two days after vaccination, you go back to your same dose, what you were doing. This is about anticoagulation. There is no contraindication for anticoagulation or antiplatelet or anything, either during COVID or during vaccination. You can continue.
Right. Right. Sir, as you told about cytokine storm, what are the factors which may precipitate cytokine storm? How can uh, yeah.
Like you people must be familiar with rheumatic fever. No, rheumatic fever is caused by streptococcal infection. It is not the streptococcal infection that is damaging the heart valve. बोलते हैं ना mitral valve खराब हो गया because of streptococcal. It is not the
Right. Right.
streptococcal infection. It is the body's response to the streptococcal infection.
Right. Yes,
Similarly,
sir.
the cytokine storm is the body's response to the COVID infection. So this is your own body's generation. And one of the ways the body generates cytokine storm is its overreaction. We have to see that it should not overreact. You should have just the right amount. If you
Right.
if you see, there are immune cells. They're called T cells and B cells,
Yes,
which
sir.
are under the control of the thymus. One of the reasons why COVID was less in children was their T cells were active and they would be able
Right.
to fight the infections. Now in adults, the only marker of our immunity is the lymphocyte. If you don't have lymphocytes in your blood count, then you have more chances of getting into a cytokine storm.
Cytokine storm. Yes.
Yeah. If there are adequate lymphocytes, generally you will be able to ward off cytokine storm.
Right.
Yes, if cytokine storm happens, what are the indications that you very rightly saw? Number one is increase in the anoxia. Your hypoxia goes on getting worsening. If you do a CT scan at this stage, it will tell you formation of ground glass appearances in the various lobes. And then we have a scoring system. You allocate some points to each of the lobes. And then
Right.
depending on the scoring system, we advise this is mild cytokine storm, moderate cytokine, like that.
Yes.
Basically, it's body's own reaction to the infection. So I think I do not know like what is the composition of this audience, whether they will understand anything more than this. I think we leave
Right.
it at this.
Yes. Yes, sir. Definitely. Yes.
And any other specific
Yeah.
question you have? Because
So, yeah, the next, the very important question that people may have this: how can they differentiate between breathing problems due to COVID infection or breathing problems due to heart diseases?
very good question. You
Thank
see,
you, sir.
heart disease, the dyspnea that occurs in heart disease is inequality between supply and demand.
Right.
So if the demand of the body goes up, like for instance, if a person is going up the stairs, he's having extra demand of oxygen and he gets breathless, that's more likely that it is cardiac. Or if he has got an underlying cardiac disease like mitral stenosis or
Right.
poor LV function, then you can say it is cardiac. The other
Okay, sir.
thing about cardiac is that if you rest the person, if he is acutely breathless, you put him at rest and give him a back rest. I mean, don't, some people may be orthopnic. They may not be able to lie down. If you just give them a back rest and the breathlessness comes down, it's more likely to be cardiac.
Okay.
Whereas the COVID dyspnea, that occurs at rest. Person may not be doing anything. He may be just at rest and he might be feeling breathless. That is how I would distinguish, especially if a person does not have heart disease and is breathless at rest, that means it's more likely to be COVID.
COVID.
Of course, now there is a confusion because sometimes RT-PCR is negative and the patient may be having typical COVID symptoms. There is no harm in treating a non-COVID as a COVID. There's no harm. If you
Right.
do physical distancing, if you give him oxygen, if you give him ivermectin, they're really not harmed. That is why All India Institute has given these drugs, which will not harm the patient in case he is not COVID. And in
Okay,
case
sir.
he is COVID, he will definitely benefit.
Okay. Thank you so much, sir,
Thank
for
you.
coming to CoViTalks. And we at Anamay Health Awareness are very honored.
Yeah.
Thank you so much, sir. Thank you.
Thank you, thank you.
Thank you.
Do give my regards to everybody
Yes, sir.
and give them the confidence that they will all come through. My request is please keep your endorphin level high. That
Yeah.
is very
Yes.
important.
Yes.
And do not do very heavy exercise because you are all youngsters. You want to go to the gym. The gyms are closed now, but don't
Yes.
do heavy exercise. Do mild to moderate exercise. Don't be idle. Don't lie in bed all the time,
Yes.
but mild to moderate exercise, and you will all be well. This is my blessing and my good wishes to all of you. Thank you.
Thank you so much. Thank you so much. Thank you.
Thank
Thanks a
you.
lot.